Rupen, how can people get you NHS-wise and within total orthopaedics, and where would you prefer to see them, if I'm honest with you? Where can you do your greatest magic?
Well, we tend to do similar kind of work both through the NHS and privately. The NHS, I'm at the Chelsea and Westminster, and privately I work with Total Orthopaedics at a variety of places, predominantly the Clementine Churchill Hospital, Highgate, and the Lister Hospital. At the moment, we're seeing referrals both through the NHS and privately, but what's happened through the NHS is, unfortunately, because there's been a huge backlog, we weren't allowed to see any new patients. Well, we're still not allowed to see any new patients within our sort of what's called the sector, the CCG environment. So we're having to triage all our referrals, but unfortunately having to refer them back to the GP at this stage. With advice. So, and I think as a result, a lot of people are at home, still dealing with the musculoskeletal pain, and I think this is where sort of rehab advice comes into its own, because if they don't have access to sort of private healthcare, there's very little else we can offer apart from the appropriate rehab. And I think we know a lot of people do get better with the rehab. So, and if they don't, they've always got that option to ask their GP to refer back again. But privately, we've been seeing patients throughout the pandemic, initially through sort of virtual consultations, and now to face-to-face consultations as well.